Imagine this, you're going about your day, everything seems normal, and then out of nowhere, you're hit with stomach cramps, bloating, and an urgent rush to the bathroom. Sound familiar? If you've ever experienced these unpredictable and often embarrassing symptoms, you might be one of the millions dealing with IBS, or Irritable Bowel Syndrome. It's something most people don't like to talk about, but for those living with it, it can make everyday life feel like a constant battle. Whether it's the food you eat, the stress you're under, or even something as simple as your daily routine, IBS can suddenly take control and throw your whole day off course. You've probably wondered, what's really causing this? Is it something I ate? Is there a way to stop it from happening? And most importantly, how can I find relief without it taking over my life? In this video, we're going to break down everything you need to know about IBS, from the top symptoms and hidden causes to the most effective treatment options available today. By the end of this video, you'll understand not only what's triggering those painful flare-ups, but also how you can start managing IBS for real relief. Let's dive in and finally bring you some answers and a bit of peace of mind.
What is IBS? Let's start by breaking down what IBS actually is. IBS stands for Irritable Bowel Syndrome. It's a common disorder that affects your large intestine, causing a range of symptoms like abdominal pain, bloating, and changes in your bowel movements like diarrhea, constipation, or even both. IBS is classified as a functional disorder. Do you know what functional disorder means? It means that there is no visible damage to your digestive system, but the way it works is disrupted. It's important to remember that IBS is a chronic condition, so managing it over the long term is key. Common symptoms of IBS. So, how can you tell if you might have IBS? The most common symptoms include abdominal pain or cramping, bloating and gas, diarrhea or constipation, feeling like you still need to go after a bowel movement, mucus in your stool. If you're experiencing any of these, especially if they come and go frequently, it might be worth talking to your doctor about IBS. What triggers IBS? Now, let's talk about triggers. What can set off an IBS flare-up? Common food triggers include high-fat foods, dairy, spicy meals, and certain artificial sweeteners. Stress can also be a huge factor in worsening IBS symptoms. Even changes in your daily routine or sleep patterns can bring on a flare. Understanding your triggers is one of the best ways to manage IBS. Keeping a food and symptom diary can help you track what causes your symptoms to get worse. Treatment options for IBS. So, what can you do to manage and treat IBS? Number 1. Dietary changes. Start by eating more fiber-rich foods like fruits, vegetables, and whole grains. Avoid known triggers and try out the low-FODMAP diet, which has been shown to help many people with IBS. Number 2. Medications. Over-the-counter options like antidiarrheal drugs or laxatives can help manage symptoms. In more severe cases, your doctor may prescribe specific medications. Number 3. Stress management. Stress reduction techniques like yoga, meditation, or even counseling can play a big role in keeping IBS symptoms under control. Number 4. Probiotics. Some people find relief by adding probiotics to their routine. These help balance the good bacteria in your gut. Remember, everyone's IBS is different, so it might take some trial and error to find what works best for you. But with the right management plan, you can reduce flare-ups and feel more in control of your symptoms. Thanks for watching. If you found this video helpful, please give it a thumbs up and don't forget to subscribe for more tips on managing your health. Comment below with any questions you have about IBS, and I'll do my best to answer them in a future video. Take care, and I'll see you in the next one.